morning, everybody. My name is John Kamen, Deputy County Executive. Thank you for being here today. It really is an important moment for us in Suffolk County, and it's something that's happening not just here. You know, the opioid crisis is everywhere, and the litigation that resulted in money coming to local municipalities is an important tool for us to move forward and make change. We started with a task force appointed by the county executive well over a year ago. We thank all those that participated in government and out of government through the not-for-profits, the hospitals, everybody that was involved gave us a window into this world, and we thank them for that. I'd like to acknowledge who's here today and then introduce the county executive. Obviously, we do have here the county executive, Steve Bellone, presiding officer Kevin McCaffrey, minority leader Jason Richburg, our chief of staff, Ryan Attard, Health Commissioner, Dr. Gregson Piggott, and by the way, this is our committee that has been appointed to create the distribution of this money, and so that is Kevin McCaffrey, Minority Leader Jason Richburg, Ryan Attard, our Chief of Staff representing County Executive, Bellone, Dr. Piggott, the Health Commissioner, and Sharon Richmond, our Victim Advocate, and so we'd like to thank them for taking the ball from task force. You know, a special note about Sharon and some of the other advocates that are here. Sharon Richmond, who's a victim advocate, her son had passed away from opioids, Vincent, in 2017. We also have Linda Ventura, whose son Thomas passed away in 2012, and is Terry here, Terry Kroll, whose son passed away, Timothy, from 2009. The victim advocates who've gone through incredible hardship through this awful experience have become beacons for those who are suffering and at risk. And they are here and participating to prevent other loss. And so we thank them especially for their contribution and their participation. Legislator-wise, we have Legislator Hahn here as well. I'd like to acknowledge Legislator Hahn, who was on the task force, and Legislator Sarah Anker, who I think will be here, who also leads the legislative task force and has done an extraordinary job in that capacity, and we thank her for her contribution and participation in our task force as well. In addition, we have Jen Culp, the Assistant Commissioner of the Suffolk County Health Department, Carrie Besserman, Director of the Division of Community Mental Hygiene Services for Suffolk County Health Department, Elise Mariota from the Health Department, and Terma Lena Longo. I'm trying to read that there, Terma, thank you. We'd like to thank all of them for being here. And some additional leaders who are here and part of this extraordinary process and are really taking the baton from here. And that's Jeff Reynolds from Family and Children's Association, Steve Chasman from LICAD, Beria Gaxiola from Strong Youth, Minerva Perez from OLA of Eastern Long Island, Vivian Hart from Pronto, Linda, and we mentioned Linda Ventura earlier from Thomas Hope Foundation, and Neela Lockle from the EAC. I would note that there was over 100 organizations that submitted, and so having some of those that are here today, we thank you for being here to participate in this, representing so many others. I'll close by introducing the county executive who led this effort. We started, as I indicated, over a year ago with our task force, where we were called upon to bring people together, to discuss the issues, to confront what we're facing, to figure out how we use resources that are coming to us to help. And that task force listened to so many people for so many hours and really gave us, as I said, the ability to look through the window of so many different worlds. And that led to the committee that the county executive and presiding officer appointed to make the decision for the distribution of funds. County executive has been a leader on this issue and guiding us to make sure that this money goes to where it's needed. County Executive Steve Bellone, thank you for your leadership in this area. And ladies and gentlemen, Steve Bellone.
Thank you very much. Thank you very much to Deputy County Executive John Kamen for all of his hard work on this. I want to particularly also acknowledge my Chief of Staff, Ryan Attard, who did a really incredible job on this from from the very beginning. This was no easy task, and we'll talk about that for sure. But I'm very grateful to her and grateful to the entire committee, my colleagues in the legislature, Dr. Piggott, and the amazing team at the Health Department for all the work that you do. Thank you. Thank you, Karen and Jen and the entire team. And to Sharon, thank you, Sharon, for having you as part of that committee was really important and critical. We are so grateful. And grateful to be here with you today. Thank you. And Linda, the same thing with you. It's an honor to be here with you today. And to the organizations that are with us here that represent just a fraction of the organizations that are receiving awards, but really some of the great organizations leading this fight against the opioid epidemic that has been so devastating. I am grateful. We have worked together over a number of years, but to watch what you do on the ground, doing very, very difficult and heartbreaking work in so many ways, and working with families that are in crisis and going through just devastating circumstances, but helping them through this, helping people survive, and ultimately, hopefully, to thrive again. It is amazing, amazing work, and I am grateful to all of you. Thank you very much for what you do. So, thank you all for being here today. As we know, for far too long, our region, much like the rest of the nation, has been plagued by the opioid epidemic. We'd begun to make real progress in the battle. Of course, in 2019, we saw opioid-related deaths decline for the first time in many years since the start of the crisis. Unfortunately, the COVID-19 pandemic, devastating in its own right, reversed that progress, and once again, we saw opioid-related deaths rising. Suffolk County has been aggressive in combating the opioid epidemic. We were the first county in the state to implement Narcan training and use by all patrol officers across the police department. We're the first county in New York State and virtually the entire nation to file suit against the manufacturers, distributors, and pharmacies who caused this epidemic and to hold accountable in some way those responsible for these tragic deaths. And I want to thank my colleagues in the legislature for their work in doing that and helping Suffolk County to lead, including one of our former colleagues, former presiding officer Rob Calarco. But my thanks. This has been a bipartisan effort and has really helped lead the nation. So thank you. As a result of the success of these efforts, Suffolk County will have more than $200 million over the next 2 decades to fight this crisis. As I've said from the outset, we are dedicated to the idea that these funds will go towards helping those individuals and families who have suffered, that these funds will go towards helping to end the opioid epidemic once and for all. Every single dollar. That is our commitment. Last summer, we announced the first round of grant funding that would be made available through an application process, and a selection panel would review the applications in conjunction with substance use disorder experts at the Health Department. In total, we received 111 applications from 77 organizations in that first round. We encouraged any agency or organization, public or private, nonprofit or profit, that is involved in this opioid fight, that has a proposal that can help, to apply for these funds. Application proposals came from a wide array of organizations, including hospital systems, municipalities, community-based organizations, youth groups. And pursuant to the legislation that was adopted last year, these proposals focused on prevention and harm reduction, treatment, and recovery. Today, I'm proud to announce that the recommendations from the Health Department and the Opioid Selection Committee for awards to 34 different organizations totaling approximately $25 million for operational expenses related to fighting the opioid epidemic. For the most part, these awards will cover a 3-year time period. In addition, the selection committee with the health department is recommending an additional appropriation of approximately $11 million for one-time awards of capital money for projects directly related to fighting the opioid epidemic. And finally, I'm happy to announce that Suffolk County will be moving ahead with a second round of grant applications. We expect to launch the second round of applications sometime later this year, giving an opportunity to those who did not receive funding in this first round to apply again, and others as well. As the first round of funding gets dispersed, the health department will be able to review and evaluate the implementation of these funds, the progress of the programs and services, and any gaps that we might need to prioritize in round 2. This first round of funding will help inform the second round. We have tried to take what I would call a responsibly aggressive approach in the distribution of these funds. So we understand we have to get these funds out. We also know this is a battle that will be ongoing, and we have to do everything we can to ensure that these funds are spent in the best way possible, because we understand the stakes. We understand that these settlement dollars can never bring back the loved ones of those who have been lost to this terrible epidemic. But our hope is that with this additional funding, we will be able to reduce suffering, prevent future tragedies, and ultimately help to end this crisis once and for all. With that, I will turn it over to my colleagues and start with Presiding Officer Kevin McCaffrey. Kevin, thank you.
Thank you, Steve. And Steve, thank you for your leadership in this role. You know, we have to remember why we are here today. And unfortunately, it's because of losses of life due to this opioid epidemic. And we're reminded of that by Linda Ventura and Sharon Richmond, who both lost their sons before their time. And I think our goal here is to make sure that we don't have to have any more victim advocates here, that we make sure that the money that we received, that is going to be put to good use, prevention, treatment, counseling, to keep this from ever happening to anybody else and any other family that's out there. And that is our goal. That was our goal when we started this committee. Suffolk County was out front in terms of seeking litigation to be able to get these funds, to be able to put them to good use. We were one of the first counties to be able to put this money out to these groups, and I think we've done it in a judicious manner and expeditious, and it's been an honor to serve on this committee. I want to thank Ryan for her hard work on this, and I always go by this, just because you make it look easy doesn't mean it is, Ryan. You know, I tell my colleagues all the time, you did a great job, and herding all the cats here and all the personalities and adding up all the numbers, and it wasn't easy. So thank you for your work, and to all the other committee members, it was a pleasure working with you, and we'll be back at it in the spring, and I look forward to putting this money to good use to help the people that really need that help. Thank you.
So I was going to say thank you to Ryan because she got us all on task. She said she was traveling around with spreadsheets all over, and then she walked into a room with spreadsheets, which actually made it a lot lighter to start the work. I think in total we had almost $170 million worth of requests. And that would just be a drop in the bucket of the work that needs to be done. And this is something that spans, you know, from Amityville all the way to Montauk, where this opioid crisis has hit. You know, Kevin and I go to our first precinct meetings, and one of the first stats they give you is the overdose stats. And it doesn't matter whether it was on one side of Lyndhurst or the other, it's touching all of our communities. And that's why it was important that we all came together and we had requests and conversations of where our priorities are, and tried to make sure that we put this money in the hands of the folks who can do the work the fastest and the best. we made a calculated decision that we weren't going to keep this money in the first round for the county. We want to make sure that the nonprofits, the organizations, the hospitals that are doing the work right now can get the money. And that was, I think, our first real agreement on the task force about that. And I think that's really important to note. And as Sharon has been a beacon of strength for us, also guided us into the right direction, really drilling down on the questions. But it also shows how important, this money is to those families, because it could be any one of us at any point in time. And so I just want us all to remember that. And as we look into the round 2 funding, think about other organizations that are doing the work, because a lot of folks have said they didn't hear about the money or the application process. We need you to reach out. And we need the round 1 groups to do a really great job, so it'll be a harder threshold for the round 2 groups. So thank you very much, and thank you, Steve, for your leadership.
Thank you very much. And I think it's important, we talked about her role on the committee, but very grateful for all the work that you've done on behalf of the victims and families, Sharon. And we'd like you to say a few words and express our gratitude to you.
Thank you, Steve, and thank you for the opportunity to be on this committee. I am grateful for the opportunity, and I am just awed by the thoughtfulness and the time and the effort, Ryan. I just can't say enough. It made it so much easier to really determine what we needed to do. And we really worked together as such a well-oiled machine, and I think that we were able to get things done. And that's most important, because when you have 107,000 overdoses, drug overdoses last year, up 28%, each person is someone's child. My child, Linda's child, and I know my only child, Vincent, would be honored to know that so many people are going to get so much help from these monies. So I am just grateful to everyone on the team, and I'm appreciative to be part of it. Thank you.
All right, we want to hear from some of the agencies, of course, and I can't think of a better person to kick us off than somebody who's been helping to lead this fight and been at the heart of it for so many years, and somebody we've relied on over the years incredibly, Jeff Reynolds. Jeff, thank you.
Thanks, Steve. I'm really proud of the fact that Suffolk got out in front of this, not only in terms of the litigation, but in getting money out the door. It's been 20-plus years in fighting this crisis, and probably 10,000 Long Islanders have lost their lives in the process. And we've gone from prescription pills to heroin to fentanyl to new contaminants now. And COVID set us back a long way. And as we began to make progress and began to save lives, we've given back a lot of that progress. And we're losing folks day in and day out, probably as we stand here. And we know that, given the numbers, there's some family here on Long Island that will wake up in the morning and be cast into a club with folks like Linda and Sharon and other families that have experienced the horror of untreated addiction. And so we're thrilled to see these dollars. We're thrilled to see the list of organizations up there, all organizations that have been on the front lines doing the work in prevention and harm reduction, in treatment and recovery. I'm really proud to be a resident of Suffolk County today. And as we think about these dollars, and certainly my organization commits and doubles down today in saying we're going to make sure that every dollar counts, both in terms of preventing future tragedies, but also in terms of supporting families. This is the way we end epidemics. This is the way we honor the lives that have been lost. And quite frankly, this is how we save the lives of Suffolk County taxpayers. So thank you to everyone up here. Thank you to the committee. Everyone else has shouted out Ryan, and so let me do the same. It's really, after 20 years and a lot of funerals, hope is a very, very precious commodity at this point in time. Things like this give us hope and hopefully mark a turning point for Suffolk County and for the state as a whole. Thank you.
Thank you very much, Jeff. Now we're going to ask Minerva Perez if she'd come forward and say a few words from Ola of Eastern Long Island. Minerva, thank you so much.
Thank you. Thank you to everyone here. Thank you to this amazing cohort that Ola of Eastern Long Island gets to be a part of, and to all the folks that will be part of the second cohort. I'm excited to learn about them and also work together. We want to thank at Ola of Eastern Long Island, over the last 20 years, we've been able to deepen and strengthen our commitment to families and to youth. We want to thank the Suffolk County Executive and his team for the sort of support and trust they've placed in us and a number of critical initiatives that we've been able to work with them on, including crisis food access for the homebound, including emergency rent assistance for those who are in need because of the pandemic, and also for the work that we've done in access to testing and to COVID vaccines for equitable access. And thank you to Dr. Piggott. There's an inextricable link between mental and emotional health access and the deficit that we have in our communities and the reliance on opioids and other substances to alleviate the very real pain, the very real depressions and anxieties that our youth have experienced before the pandemic, and certainly now even worse during the pandemic. We're not after yet. The work that Ola has been able to develop in terms of our Youth Connect and our direct reach and work with the 24 East End districts that we work with, our 10 police departments, continuing to work with the county and to work with other community-based organizations, is allowing us direct access into the living rooms, the family structures in both English and Spanish across our entire region. We are now making sure that effort is going to continue throughout this entire time of this grant and beyond, because we are fully committed and every one of our dollars is going to count toward this effort. We need to make sure that this ends, and this ends with us. And again, we thank everyone here, and especially the county, for the work that they've done. Thank you.
Yeah. All right, and now I would like to ask my colleague, Karen, to say a few words. She was on the task force, and she has been a huge advocate on this issue. And then, Linda, if you wouldn't mind, I would ask if you would close this out. Then, okay, Karen, thank you.
You know, as a social worker, as a mom, community member, someone who's lost family and friends to the crisis of addiction, every minute counts in the distribution of these funds. And in a real way, lives are at stake here. I want to thank everyone who worked so hard, Ryan. Clearly the hardest. Jason, for your hard work on behalf of our caucus, our presiding officer, our county executive, our health commissioner, everyone who did all this work to make sure that these funds get out into the community. Listen, I wish they were there 6 months ago, but you really spent the time, and it was very hard work to decide you all decided who was ready now and who could spend it the best and truly save lives. And I'm grateful that we're announcing this today. I look forward to announcing more, getting more money on the street to save lives, because people are still dying. So thank you.
Thanks, Karen. Thank you. Very glad to be here with you today.
Well, you know I'll be back. So I'm so grateful that yesterday I hit the ground, because I'm so grateful to be able to do the work that we do at Thomas's Hope, and the best way I can describe it is to be the people that I wish my son had holding his hand, and to be the people that I wished I had to help hold space for me, to listen, to not have all the answers, but just to be present in this insidious disease, because people are just lost, and everyone keeps those thoughts quiet, and it's a sick family secret still, and the stigma, we still need to do so much work around that. You know, December was a tough month. I know in 2 weeks we lost 3 people, all under the age of 24. So it always comes back to smack you in the face, the reason why. And I'm so grateful, and I know that my son is standing right here, right now, because we will change the world for everybody that's going to come up into it. And we're focusing on opioids, but we need to remember that the substance is unimportant, and there's so much stuff going around, and on our youth with the mental health crisis that they are in because of the pandemic and everything. There's just endless work to do, and it starts today, and it starts now, and it starts with me and each person here, and that's the best we can do. Thank you.
Well, okay. That is the perfect way to end. Are there any questions?